Welcome to Medicare School Daily, where we help you understand Medicare, save money, avoid mistakes, and above all else, get the most out of your Medicare benefits. Now, today's topic is the advantages of Medicare Advantage Plans. Now, when you go on Medicare, you're going to realize that you only have three options of using your Medicare benefits. Number one, you can choose to stay in the original Medicare A and B system. And when someone only has A and B, what that means is Medicare A and B is going to be the first payer. And then anything that remains of the balance, we call those gaps, you are going to be responsible for those. So Medicare is going to pay first, and you're going to be the secondary payer. And as secondary payer, there's no limit to what you can have to pay out of your pocket. All right? But that is one option that you have, and some people choose A and B only. Now, the second option is to stay in original Medicare A and B, but then add a supplemental plan to that. Because of all the gaps, some people say, I don't want to be responsible for those, so they will buy a supplemental plan. So instead of you being responsible for the gaps, this supplemental company is going to pay all those gaps for you, or most of those gaps for you. And then the third option when you go on Medicare is to do what is called a Medicare Advantage Plan, and these are also called replacement plans. Replacement plans. And the reason they're called that is because what happens is that private health insurance company replaces original Medicare A and B for you. You pay copays and they're responsible then for the balance. So those are our three options once you decide to go on Medicare. Now let's look at the advantages of the Advantage Plan. What is the advantage of the Advantage Plan versus original Medicare A and B only? Well, there's one primary advantage, and that is this. If you choose to stay in A and B only, you've already seen that you're responsible for those gaps, but those gaps are totally unlimited. So whatever Medicare didn't pay, all the balance of those bills you're responsible for. So really, sky is the limit. Very, very risky. And that's the advantage of the Advantage Plan versus A and B only, is because the Advantage Plan will set a max out of pocket for the year. Those are typically, depending on where you are in the country, they're going to range anywhere from about $3,500 to $10,000 a year. Now, that's still a lot of money, but at least up here, this could be $100,000 or $200,000 because there's no limit. Here, at least that Advantage Plan is going to set a max out of pocket. So there is the advantage to the Advantage Plan versus original Medicare A and B only. Now, what would be the advantage to the Advantage Plan versus original Medicare with the supplemental plan? Well, original Medicare, remember, A of Medicare for most people is a zero premium. For most people right now, B is $144.60 a month. So you've got to pay for your A and your B. B is the premium. Now, if we had a supplemental plan, you're going to have to pay a premium. You're transferring the risk of those gaps to the supplemental company, and they're going to require you to pay a premium. Now, it varies throughout the country, but on the average, they're going to be about $100 to $150 a month for your supplemental plan premiums. Now, that's all based upon your age and your gender, your tobacco status, and of course, where you live in the country. But you do have to pay a premium for them to take that risk from you. All right? And so if we take an Advantage Plan, there's an advantage in this area of low or no monthly premiums. Now, when I say low, there are many plans in the country that are certainly zero, and on the low side, maybe $29 a month. So they're very, very low cost. And so what's happening, instead of having to pay premiums here, you have an Advantage Plan where you pay copays and they take care of the balance. So there's very little or no monthly premiums. Also, if you take an Advantage Plan, they will include a prescription drug plan as part of your coverage. They make that embedded within the plan. If I go up here, what happens is I have to add a drug plan to my coverage. The national average right now for a drug plan is $30 a month. So we have a premium. Now, there are some that are certainly less than that, others that are higher, but the average is about $30 a month throughout the country. So I've had to pay the supplemental company, I've had to pay the drug insurance company as well. Over here, they just make that part of my package. So again, very low or no premiums. And then the other reason is for perks. A lot of people like the perks that are thrown in with Advantage Plans. The perks are this: dental, vision. Some of the plans will throw in some hearing benefit, a hearing test and maybe some hearing aid type benefit, as well as gym memberships. Now, when it comes to the dental benefit, it's typically around about $1,000 a year of benefit. Vision is normally a preventive eye exam and then some credit towards eyewear, somewhere usually between about $150 to maybe $250 a year towards eyewear, glasses and contacts. Hearing, that would be a hearing exam, and then certain hearing aids that would be part of the benefit package as well. And then the gym is typically what we call a silver sneakers. It's a network of facilities, YMCAs and community centers, maybe curves, different places where you can go with your Advantage Plan membership and it doesn't cost anything to be a member at that particular facility. All right? So those are the perks that are thrown in. Now, you can get these perks with the supplemental plan, but they have to be added. There would be a separate premium for that. Here, it's just part of the package. So those are your options once you decide to go on Medicare. If you choose number one, original Medicare A and B, I think you can see now this is tremendously risky. And some people don't want to assume that amount of risk where they have an unlimited amount out of pocket. Or you can go number two, original Medicare, and get a supplemental plan and a drug plan. Now again, this carries more monthly premiums. Why? Because you've transferred the risk away to an insurance company. Now, you may spend less out of your pocket if something seriously happens to you here, but you have to be able to afford that in your monthly budget. And then number three would be the Medicare Advantage Plan. We've seen the advantages to that. Now, folks, honestly, if I had a crystal ball and I knew that I was never going to be seriously ill the rest of my life, then I would be all over number three. Okay, you would save a tremendous amount of money. Now, we don't have the crystal ball, of course. I would also tell you that if your budget is very tight, where you really can't afford the premiums in this system, then it is better for you probably just to pay as you go in this Medicare Advantage plan. To learn more, watch the related video or check out our most recent video. Also, be sure you click to subscribe for free and get notified every time we post a new video. To watch our complete Medicare workshop, go to MedicareSchool.com. And finally, when you're ready to compare all your insurance options and get free enrollment help from one of our Medicare School guides, call the number on the screen. See you next time.